Good afternoon, everyone. My name is Christy Degner, and I'm a Site Engagement Coordinator for the Michigan Value Collaborative. Thank you for joining us today for MVC's first Lunch and Learn session. Today, I'm going to walk through an overview of MVC, including our main areas of work and the basics of MVC data. Before we begin, I have a few housekeeping items to review. First, this session is being recorded. The slides and the recording will be shared with the attendees following the presentation. Additionally, we will be monitoring the chat throughout the presentation, so feel free to add questions there. We also will have a designated time for Q&A at the end of the presentation. Lastly, your feedback is very important to us, so if you could please complete our post-session survey in the link that will be provided, that would be greatly appreciated. So to begin, I want to review the guiding principles of MVC's work. MVC's purpose is to improve the health of Michigan through sustainable, high-value healthcare. Driven by our vision of people accessing the right care at the right time at the right cost, MVC assists its members to better understand their performance using robust multi-payer data, customized analytics, and at-the-elbow support. Led by Director Hari Nathan and Co-Director Mike Thompson, the MVC Coordinating Center, located in Ann Arbor, Michigan, has grown to 18 team members. Together, we have expertise in program management, data analytics, site engagement, and communications. And we are also fortunate to have insight from both clinical and non-clinical faculty that help inform our areas of work. Established in 2013, the Michigan Value Collaborative is one of 24 collaborative quality initiatives, otherwise known as CQIs, under the Blue Cross Blue Shield of Michigan's Value Partnership Program. This year, we are celebrating 10 years of episode-based insights on healthcare value. At its inception in 2013, the primary focus of MVC was to improve the quality of care within hospital settings. However, in 2018, MVC expanded its membership to physician organizations and to date continues to find ways to incorporate other healthcare delivery settings within the collaborative. Currently, there are 103 hospitals and 40 physician organizations, which are dispersed throughout Michigan, as you can see in the map of Michigan to the right here. As you can see, our members represent a large geographic area and serve diverse patient populations. Among these patient populations, MVC looks at more than 40 different surgical and medical conditions through processed claims data. So now that I've provided a high-level background of MVC, I'm going to review MVC's scope with the goal of answering these questions. What does MVC do and for whom? So to help MVC achieve its mission, MVC focuses on 5 main areas of work. I will go into further detail on these main areas of work in the next few slides, but I would like to provide a brief overview of each here. The first area of work that I would like to highlight is data analytics. MVC uses high-quality multi-payer performance data to drive collaboration and quality improvement. MVC offers hospitals access to a data registry, allowing them to benchmark their care utilization to the state, track changes over time, and identify areas of cost opportunity. All MVC members also receive specialized push reports and can request custom analytic reports as well. Turning our attention to hospital and PO engagement, the goal here is to foster an environment for collaboration and shared learning. So this is accomplished through collaborative meetings, virtual work groups, regional networking events, MVC registry trainings, and other online support tools. Regarding performance benchmarking, Blue Cross Blue Shield of Michigan allocates 10% of its pay for performance, otherwise known as P4P program, to a metric based on MVC data, and that is referred to as the MVC component of the Blue Cross Blue Shield of Michigan P4P program. And this allows MVC members to benchmark their performance on specific selected conditions. Additionally, MVC drives improvement and collaboration through specific focus areas, otherwise known as Value Coalition Campaigns or VCCs. Currently, our 2 VCCs focus on increasing cardiac rehabilitation utilization and reducing unnecessary preoperative testing for low-risk procedures. Lastly, in addition to our hospital and PO efforts, MVC collaborates with many specialty-specific CQIs, and together we work to understand variation in healthcare use, identify best practices, and lead interventions for improving care before, during, and after hospitalization. So now I would like to go into a little bit more detail regarding our data analytics area of work. MVC data is shared via multiple platforms, which are highlighted on this slide here. The first that I'm going to speak to is our MVC data registry, which is claims-based and organized into episodes. The data on the registry dates back to 2015. And if you are an MVC member and do not already have registry access, you can email us directly to get that access or request it via the registry website. Here, I just wanted to quickly highlight an example of one of MVC's registry pages, which is the Key Insight Readmissions table. Push reports are also used to supplement the data on the registry, and these reports focus on common areas for quality improvement to provide greater detail into patient populations and cost opportunities. Some topics of past push reports include health equity, joint preoperative testing, and chronic disease management follow-up. And on the screen here, I just wanted to highlight our health equity reports. I'm going to zoom in so you can see that a little bit better. So in addition to these push reports, members can request specific conditions or areas of care to look at through a custom analytics report. And to do that, members can submit a custom analytics request, and then a member of our analytics team will meet with you to discuss potential options for that report. And lastly, I am going to highlight down here a case study that was developed to outline the impact and value of a custom analytic request related to COPD readmissions and episode spending. Lastly, MVC data is shared at our semi-annual collaborative-wide meetings. And unique to these collaborative-wide meetings, we do have a session for unblinded data review. So now turning to the engagement side of MVC. Here, like I stated earlier, is where we aim to foster a collaborative learning environment that enables members to learn from one another in a cooperative and non-competitive space. And to facilitate this, the MVC provides the MVC Coordinating Center provides multiple different engagement events, and those are listed on the screen here. Our first of which are our flagship events, which are our semi-annual collaborative-wide meetings, and those are held in May and October of each year. And our semi-annual meetings bring together all MVC sites for an engaging day of presentations and discussion, including that unblinded data review. Additionally, we host peer networking events, which are more of an informal opportunity for sites to come together and connect with each other and share ongoing quality improvement efforts within their organizations. We also have site visits, which provide an opportunity for MVC staff to meet one-on-one with our members, so we can really learn more about what's going on in their organization and hear about how MVC can best support them. To share MVC news and highlight MVC success stories and success stories of our partners, MVC does have a presence on LinkedIn and Twitter and releases weekly blogs. We also provide custom support for the MVC online data registry, and that includes introductory sessions to get you familiarized with the registry, as well as advanced training sessions once you are familiarized. Lastly, we do host virtual work groups, which are more formal sessions focused on a specific condition or area of interest. Our current work groups include chronic disease management, diabetes, health equity, and health in action. Work groups typically occur twice a month and they're open to all MVC members. We are always looking for feedback on our work groups and ideas for future topics. So if you have any, we encourage you to reach out to us. Also, if you would ever like to highlight the work going on within your facility, we definitely would love to hear from you as well and have you present at one of our work groups. So if that interests you, definitely reach out to us. So now I'm going to talk about how MVC assists its members benchmark their performance via the MVC component of the Blue Cross Blue Shield of Michigan Pay for Performance program. As stated earlier, beginning in 2018, BCBSM allocated 10% of its P4P program budget to an episode of care spending metric based on MVC data for a variety of conditions. And as you can see with the goals outlined on the screen here, this MVC metric really endeavored to achieve fairness and transparency, measure validity, align with Blue Cross Blue Shield of Michigan and CMS quality measures, and have a meaningful impact on quality improvement. So to review what will be happening in the calendar year 2023 as it relates to MVC's component of the P4P program, first, hospitals will receive their final scorecards for program year 2022. These scorecards were actually sent out last week to hospital site coordinators at each facility. And second, hospitals' assessment for program year 2023 will begin with mid-year scorecards expected in Q3. Moving forward, I would also like to note that there have been a few changes that will go into effect for program years 2024 and 2025. Hospitals will continue to be evaluated on their risk-adjusted price standardized total episode payment for a selected condition. However, they will also be evaluated on a selected value metric, which is an evidence-based and actionable measure. Regarding value metrics, hospitals will be rewarded for high rates of a high-value service or low rates of a low-value service. And two of the services center around our value coalition campaigns, which I will detail more in the next couple of slides. If you want to review in further detail any of these changes for program years 2024 to 2025, as well as any other P4P resources, they are located under the resource tab on our website. So as I alluded to, as part of MVC's commitment to improve the health of Michigan through sustainable high-value healthcare, the Coordinating Center develops specific focus areas which member hospital and physician organizations are concentrated in to drive improvement. And those are known as the Value Coalition Campaigns, or VCCs. MVC's current VCCs focus on cardiac rehabilitation and preoperative testing. And to give a brief background of both of those, I would like to share our What to Know introductory videos for each. So first is the Cardiac Rehabilitation VCC. And the Cardiac Rehab VCC was formed with a goal to equitably increase cardiac rehab participation for all eligible individuals in Michigan. In addition to our own efforts to increase cardiac rehab participation, MVC also contributes to the Michigan Cardiac Rehab Network, which is a collaboration between MVC, BMC2, and MST-CVS. And this collaboration engages cardiac rehab stakeholders to outline best practices and support meaningful improvement at sites. So now I'm going to share about a 2-minute video for you to learn a little bit more about our Cardiac Rehab VCC. Next, I would like to highlight MVC's preoperative testing value coalition campaign, which aims to reduce the use of unnecessary preoperative testing for low-risk surgical procedures. In addition to MVC's own efforts to reduce preoperative testing, MVC also collaborates with MProve and MSQC to support their preoperative testing efforts and outline best practices. So I'd like to share another 2-minute video that outlines our preoperative testing VCC. So our final area of work that I would like to discuss today is CQI collaboration. So CQI collaboration typically involves one or more areas. So with regard to the MVC online data registry, our CQIs, other CQIs provide guidance on the development and creation of new MVC episodes and conditions. Also, our CQI partners assist with report development and sharing. So for example, our cardiac rehab reports are developed and disseminated in conjunction with BMC2. Our preoperative testing reports are shared with MSQC, and we have also collaborated with Inhale for our COPD physician organization reports, just to name a few. By leveraging MVC data on healthcare cost and utilization, MVC also works with CQIs to look at the impact and value of CQI-led clinical initiatives through building of impact and value assessments. So overall, MVC's collaboration with other CQIs allows for the matching of rich clinical data with MVC's comprehensive claims data to really show the value equation that we're seeing on our screen here. So before we move on to getting into the basics of MVC data, I just wanted to highlight the CQI portfolio, which contains the 24 CQIs under Blue Cross Blue Shield of Michigan's Value Partnership Program. As you can see, the CQI portfolio has diverse clinical focus that spans hospital and physician organization members. So now I would like to review a little bit about MVC data. and with the goal of answering these questions. Where does it come from and how is it organized? What is an episode? So this slide highlights MVC's data sources. So MVC's administrative claims data captures approximately 84% of Michigan's insured population. And that includes data from Blue Cross Blue Shield of Michigan PPO commercial and Medicare Advantage plans, Blue Care Network HMO commercial and Medicare Advantage plans, Medicare fee-for-service, and Medicaid. MVC requests and updates the data as frequently and quickly as possible. However, due to the nature of claims data, there are some delays. We are fortunate to receive our Blue Cross Blue Shield of Michigan and Blue Care Network data directly from Blue Cross on a monthly basis, amounting to about a 3 to 4 month lag in that data. Our Medicare fee-for-service data is received quarterly, amounting to about a 9 to 10 month lag. And then our Medicaid data is received every 6 months from the Child Health Evaluation and Research Center, with about a 9 to 10 month lag in that data as well. I would like to note that the MVC Coordinating Center continues to expand the impact and value of our data through these new data sources and metrics and improved visualization and communications. And we're always looking for feedback on how to best support you understand the data you're seeing. So now that we've reviewed the sources of MVC data, I would like to highlight what MVC data tells us and how it's organized. So our data looks at 30 and 90-day episodes, and we report on 43 medical and surgical conditions coming from 16 different service lines. An episode includes the index admission, whether that be a hospitalization or outpatient surgery, professional services, post-acute care, and readmissions. For the facility index payment, that is going to include any base, outlier, or inpatient transfer claims. Sorry, go back. For the professional services payment, that's going to capture surgical and non-surgical procedures, durable medical equipment, any labs, radiology, anesthesia, any evaluation, management, office visit, consult visit, or any outpatient rehab professional claim. In the post-acute care payment space, that is going to include ED utilization, skilled nursing facility, home health care, and inpatient and outpatient rehab claims. And then lastly, for those readmission payments, that is going to be related to any readmission during the 30 or 90-day window post-discharge. It also is important to note that the data is risk adjusted for several variables, including age, gender, insurance type, high prior 6-month payments, and end-stage renal disease. In addition to it being risk adjusted, it is also price standardized, and that is done to eliminate the extent of price variations due to negotiated contracts, inflation, wages, geographic region, or any other hospital characteristics. So with all of that being said, we are therefore not showing an actual dollar amount, but rather a measure of utilization. So this is how we can best compare hospital to hospital within the collaborative. So some recent news that MVC would like to highlight is that in June of 2022, MVC was certified as a qualified entity, meaning that we can now share Medicare patient level data on our registry with authorized users. An authorized user is a provider, or in MVC's case, a hospital with a relationship with a patient in the last 24 months. So in July of 2022, MVC member hospitals received a QE data use agreement to be reviewed and signed by an authorized representative from their institution. And this signed DUA is a prerequisite for receiving access to this new QE page on the MVC registry. And once a QE DUA has been received, the authorized hospital users will have access to both the existing Medicare fee-for-service report as well as this new QE report. The QE Medicare data is contained in a separate tab on the MVC registry, and the data on this QE page is available for the most recent 18 months of index admissions. And the benefit, like I outlined at the beginning of this slide, is that it does not have any case count suppression, allowing for users to really look at the more patient level data and more granular perspective that is otherwise censored in the Medicare fee-for-service reports. So that was an overview of MVC. Thank you again for being here today. So now that you have this overview, I wanted to share some ways to continue to engage with MVC moving forward. So the first is, if you do not already have registry access, like I had mentioned earlier, you can request it. There is a link to request the access here that will direct you directly to the Arbormetrics registry page. We also encourage our members to attend our virtual work groups. Please see the attached work group calendar, which I've linked on this slide here. As stated earlier, we are always looking for topic requests, and if you are interested in highlighting the work of your organization at a work group, please reach out to us. Additionally, to sign up for MVC updates, including MVC weekly blog post, as well as work group reminders, I've included a link to sign up for those emails as well. And then I would like to highlight that on May 19th from 10 to 3, MVC will be hosting its MVC's Spring Collaborative Wide Meeting. And this spring's meeting will focus on interdisciplinary collaboration, care transitions, and highlight success stories from MVC's 10 years of partnership with healthcare providers. At this meeting, we are organizing a poster session to feature success stories from this last decade, as well as the excellent quality improvement work going on within all of your facilities. So we definitely encourage you to submit a poster if that would be of interest to you. And we ask that you please submit those posters by May 5th. And lastly, if you're not already doing so, to get most up-to-date news and hear about what's going on in MVC, as well as what's going on in our member organizations, please follow us on Twitter and LinkedIn. So I wanted to thank you all again for your continued support and partnership. As always, if you have any questions, please reach out to the email listed on this slide here. And I also would like to give everyone the opportunity now, if you have any questions, to ask them. Feel free to unmute or put your questions in the chat. I'm going to turn it over to MVC's program manager, Erin Conklin, now to facilitate this Q&A.
Thank you so much, Christy. And again, thank you everyone for participating and joining us today. Does anyone have any questions for us? Christy provided a lot of great information during the session. Oh, Chris, thank you so much. So Chris is asking, are there any upcoming database trainings? Thanks so much for the question, Chris. So we can schedule one-on-one trainings with you or members of your team at any time for the MVC registry. You can email the email that's on the screen, michigan-value-collaborative@med.umich.edu, and we can set something up. Additionally, we are hosting our next MVC Lunch and Learn in June, on June 14th, and that will focus on a run through of the MVC registry and talking a little bit about our reports and things like that. So that will definitely be a time when we will be able to share a little bit more about the registry. But if anyone is interested in kind of doing a deep dive into your registry data and get a registry training specifically, we are happy to schedule them one-on-one. Any other questions? Regina, thank you. Can we download the cardiac rehab video to show to our cardiology fellows and staff? So I believe that our cardiac rehab video is available on the MVC website, and we can also direct you to that along with the cardiac rehabilitation toolkit that was developed in coordination with the Michigan Cardiac Rehab Network. But we would be happy to share those resources with you. Additionally, we are doing a series of cardiac rehab work groups for folks who may not be aware this year as part of our focus on our value metrics. So we would be happy to share any additional information and materials with you. Jana has put a link to the cardiac rehab video that is on YouTube in the chat. So you can grab that and bookmark it and share it broadly with your teams. Thank you so much, Jana. Jana, if I'm not mistaken, I think the pre-op video is on our YouTube channel as well. Yes, perfect. I think that the pre-op video is on our website for other folks who are interested in that value metric or that improvement initiative. Any additional questions out there from the group? And feel free, if you'd like to unmute, you can ask any questions directly or put them in the chat, whichever is easiest. Great, thank you so much, Jana. Jana dropped the pre-op testing link in the chat for anyone who's interested. Well, as Christy mentioned, we do have our spring collaborative wide meeting scheduled in May. We would love to see you all there in person. It's a great opportunity to connect not only with the MVC team, but also with our member organizations so that you can network with your peer institutions. We've got a great agenda scheduled, and the invitation will be going out later this week, I think, early next. So keep a lookout for that. Any last minute questions? We can give folks some time back. And yes, we will provide the recording and slide deck will be distributed to the registrants for this meeting, which you all will be included in that distribution, along with a link so that you can provide some feedback on the session and also provide comments on anything else that you would like to hear from MVC in either work groups or future lunch and learns. So that will be coming in the next few days. One more comment, just if you are interested, we are always open and available to do kind of some MVC 101s with your staff. If you think there are other folks within your institutions who might be interested in learning more about MVC, we are definitely able to do kind of focused presentations for your team. If that's something that you would be interested in, please don't hesitate to reach out to MVC. We can bring you a specific presentation if that would be helpful. Last call for questions. Well, again, on behalf of the Michigan Value Collaborative, first, I would like to thank Christy for delivering the presentation today, and I would like to thank everyone for participating and joining today. We hope that it provided some insights into MVC, and please don't hesitate to reach out. Follow us on Twitter and LinkedIn, and we look forward to seeing you at future MVC events. Thanks, everyone.
Thanks so much, everyone. Have a great day.